Good evening, everybody. My name is Ede Emanuela, and I'm going to be your moderator for this session today. Firstly, I would like to ask everybody to please turn on your camera so we can take a quick picture. Please, everybody,
Hello,
turn on
Emanuela,
your...
can you hear me?
Yes, I can. Good evening, sir.
Okay, good evening. How many groups do you have today? Two
There are two
groups,
groups
right?
today, sir. Yes, sir.
Okay. We are going to take the group that worked on what is it called? On healthcare fraud and abuse. We will take that. Then next week or within the week, we take medical negligence, malpractice, and patients' rights. You see, the two topics, in fact, each of them is actually a full course. So when I saw it, I said, let them work. Let them do their research. When we come today, we will split it. So we are going to take healthcare fraud and abuse. Then next week we would tackle patients and that's the content medical malpractice and patients' rights. So I hope the two
Okay.
groups are hearing me because I want to when we are done today, you will understand the reason. The course content, what I have for today's course is much. So if we took the two, we will not be able to exhaust my slides. Okay, so
Okay,
go
sir.
ahead.
Okay, so we'll be starting from the presentation of the mentees. That's the group that was in charge of conducting their research on healthcare fraud and abuse. Please, are you ready to present? The presenter or the backup presenter, as I said, the topic is a very broad one. So please, the presenter for that group should please start the presentation. Group one. I'm sorry, you're not very audible. I don't know if it's the network.
Good evening, everybody. Thank you
No. What's the problem? Can you turn off? Can you log out and log in again?
I don't know if everybody can hear me. I just want to ascertain nothing.
Yes, we can hear you. Go on.
Can the presenter log out and log in again?
And please, the presenter for group one, please try logging out and logging in again. Or if there's a backup presenter or somebody else in the group, you can take over for her till her network is stabilized, please.
Good evening. Is it better now?
Yes, it is.
I think it's better on my end.
All right. Thank you so much. My name is Modupe Sijola, and one who will be presenting.
Modupe, yes, I got the first name. The second one?
It's Sijola Modupe.
Okay. Go ahead.
All right. So we'll be presenting healthcare fraud. Please just a minute, because I was told that someone will help me share the screen. So I'm trying to contact him, Sir Dennis, to help me share.
Please, can you kindly give me a moment? Can you start with the presentation while I try to share your screen for you?
All right, thank you very much. So our topic for today, we're group one, and the topic for today is healthcare fraud and abuse, medical malpractice, patients' rights, and evidence gathering. So we'll be discussing this.
No, just stop on healthcare fraud and abuse. I thought, Dennis.
Yes,
Hello,
sir,
Dennis.
Yes, I can hear
Okay.
you.
What topics are each of the groups presenting on?
So Group 1 sir is presenting on health tech fraud and abuse, and then Group 2 will be discussing on, or they are discussing more on patients' rights. So
Who is discussing patients' rights?
that's Group 2, sir.
Group 2. Okay, let's take the one on healthcare fraud and abuse.
All right, so thank you very much. I'll be discussing healthcare fraud and abuse. So we'll be discussing on it under the following topics, subtopics: healthcare frauds and abuse, the definition and the differences, the examples of healthcare frauds, examples of healthcare abuse, how to detect healthcare frauds and abuse, medical malpractice, the definition, common trends in medical malpractice, preventive measures, and then the conclusion. So by way of definition, healthcare fraud is defined as a deliberate deception or misinterpretation of facts for financial gains. It involves intentional acts to defraud healthcare programs or patients. So what I want to bring out from this statement is that it could involve programs or patients. So I'll give an example. Let's assume I have a hospital, or I work in a hospital, and then someone comes to me and says that is feeling stomach pain. And then I say, oh, the stomach pain that you're feeling, of which I know, like I'm aware, I'm very much aware that the stomach pain is nothing related to any head injury, any head problem or something. And I tell the person, oh, go and do an MRI for your head, because I want to intentionally collect money from the person. That is a way of that's an easier way to look at healthcare fraud to the patient. Then for healthcare programs, let's assume I currently run a system where I treat cancer patients, and then I'm undergoing various clinical trials for treating the said cancer patients. And then I manipulate my figures and facts just because I want some certain organizations, let's say United Organization or World Health Organization, to fund me, and I manipulate the figures, knowing fully well that what I am doing does not give the results that I put in. That is a way of definition of healthcare fraud for programs. So healthcare abuse is defined as a practice that is inconsistent with accepted medical businesses and fiscal practices. So the difference basically is that healthcare abuse might not be intentional. So for example, somebody comes to me, I'll use the same example. Someone comes to me and says, oh, to my hospital, and says, oh, I have this tummy pain. And I say, oh, this tummy pain, it can be as a result of headache or a brain cancer, for example. And I tell you, go and do a brain CT. And it is not related, but just to rule it out, of course, you overspend, and that might be a form of healthcare abuse because you spent the money that you are initially not supposed to spend. But the person who prescribed those treatments did not know that, oh, you should not have done it. So it says here that it might still lead to unnecessary costs or compromised patient care. So examples of healthcare fraud. I'm on the next slide. So the examples of health, I don't know if you can still hear me. I'm on the third slide now. Examples of healthcare fraud. Sir Dennis?
Yes, sir. Yes, we can.
Okay, thank you so much. So examples of healthcare fraud includes billing for services that are not provided. Like I already said, submitting claims for treatments or procedures that were never performed. So I come to the hospital and I say, I have headache, and you give me paracetamol for my headache, and I'm about to pay for the paracetamol, and then you're telling me that, oh, for this paracetamol, you also took tetracycline or Flagyl, of which I'm aware, the doctor, both of us are aware that I did not do such a thing. I did not use such drugs, or I did not purchase such drugs. But you still asked me, you went ahead to ask me to pay for these drugs. So this is an example of billing for services that were not provided. Then false claim. False claim is simply submitting claims for services that were medically unnecessary or not documented. So I know by way of by way of privilege, let me just say that whatever you do not document is assumed that you do not do it. You did not perform that procedure or whatever. So I'm a medical student, and my consultants, the consultants that teach us, they always emphasize on the fact that we need to document every procedure we do. So if false claim is that you are telling me that, oh, I have I'm using examples so it can be relatable to everybody, because the topic might seem somewhat abstract. So I come into the hospital today, and then you tell me that I have to do a CT or a larynx or ECT or something, different procedures, and then you did not document, you did those procedures off the book. You did not document that these are the procedures I asked you to do. You just say, oh, go and do it. You just write a small paper to the person and say, do this thing. And then it's not properly documented. And at the point of payment, you ask me to pay for all of those. You will now over-exaggerate the prices. I don't know if we're still following. You over-exaggerate the prices of the things that you asked me to do because you did not document them. So that's an example of healthcare fraud. Then upcoding. Upcoding is simply billing for a more expensive services than the one provided. So I know that if somebody has appendicitis, for example, what you should do, appendicitis is originally a clinical diagnosis. You should not say, oh, go and do it. Appendicitis is basically inflammation of the appendix. So you should not say, go and do a CT scan that costs over 120,000 for something that you can diagnose clinically. Clinical diagnosis is, oh, you come to the hospital, I check you out, I look at you, check your physique, do some tests, palpations and all of that, and I'm able to diagnose that, oh, you have appendicitis. That is clinical diagnosis. But diagnosis involving CT scans, MRIs, these are machines that are very, very expensive. And then you tell me because of common appendicitis, because maybe you have scaled the patient or sized up the patient, and you say, this one looks like somebody that has money. Let me tell him to go and do CT scan. And you tell him to do CT scan that costs over 120,000 for something that you can diagnose, just by asking some questions. That is what they call upcoding, and is an example of healthcare fraud. So kickbacks basically mean offering or receiving bribes in exchange for referral or business. This one is very, very common, and it can happen very, very subtle. Subtle in the sense that somebody comes to the hospital, there's a line. For example, there's a queue that let's say we came to see a consultant or something, they have their clinic days. And then you now say, because you are willing to offer, there's a queue, let's say I'm supposed to be number 30 and there's somebody that's supposed to be number 1. And you now say, oh, I'm willing to pay you like 20,000 to allow me to see the consultant first, or to allow me to do this procedure first. And then you bribe your way into doing that. So that's an example of kickbacks. And it is also, like I said, it's very subtle, because sometimes some people do it and they just feel like it's connection and all of that. But it's an example of healthcare fraud. So overutilization. Overutilization basically means providing unnecessary or excessive service. Underline the word unnecessary. Unnecessary is, I've explained it. I gave an example for appendicitis. You tell me to go and do CT scan that costs over 120,000. That's basically unnecessary, because you can diagnose this thing without the help of this test. And then excessive services. You tell me, okay, because I came with stomach ache, you're telling me to go and do an MRI. MRI costs over 200 and something thousand. You tell me to do a CT scan that costs over 120 something thousand. You tell me to do an ultrasound scan, that one costs about 5,000 to 6,000 naira, just for something that, if you can use one test to diagnose this thing, you necessarily don't have to use the rest of the 3 tests, right? So that is an example of overutilization. Unbounding basically means billing separately for components of a single procedure. So I'll give a very, very vivid example for this that will make us all understand. So you come into the hospital and you say that I have stomach pain, for example, or I want to undergo a surgery, and the surgery should ordinarily cost, let's assume, 60,000 naira. But in the process of pain and billing and all of that, the surgery should encompass the cost of the anesthetics you are going to use. The surgery should encompass what you are supposed to pay the nurses. The surgery should encompass the number of syringes and suture lines you are supposed to use. The surgery should encompass correct word. Surgery should contain the number of oxygen gases that you are supposed to use. But because you want to deliberately collect money from somebody, and all of that thing is supposed to be 60,000, then you now bill separately. Oh, for the mask that you use, though, it costs an additional 20,000. So we're going to add it to your 60,000. For the mask that you use, for the anesthetics that came, that anesthetics is going to collect 40,000. That is an example of unbundling. It's billing separately for components of a single procedure, and that is basically an example of healthcare fraud. So double billing, submitting multiple claims for the same service. Like, if this one is, I feel like it's very, very self-explanatory. You come to the hospital, you say you want to do this test. They say, okay, to see a doctor costs 5,000. And then
JP, are you still with us?
What's the challenge?
Is there a backup presenter that can take over from her if she gets back? Group one, are there any other members of Group one here that can continue the presentation for her till she resolves the network issue for herself?
Who are the members of Group 1, Dennis? Just call out their names. Then I'll pick who will continue the presentation. It's a group work, so I presume that every member of the group participated in the work. Hello, Dennis, did you hear me? Hello? Emanuela, can you hear me?
Yes, I can,
Hello?
sir.
Yes,
Everybody
I
hear
can
me?
hear you.
Okay,
Let
just
me.
call out the names of the group members. It
All
is
right,
a
sir.
group.
I'm coming. Please, a moment, sir.
Okay.
Okay, for group one, we have Damian God's Gifts. We have Deborah Tuluani.
Confirm who is on the call amongst them. The names you have called, confirm who amongst them is on the call.
I can't see anybody on that group on the call.
Whoa, interesting. So it's only the presenter. Are there the only two people? Continue the names.
Okay, Dupe is back with us.
Okay. Okay, Dupe. Hello, Dupe. Can she hear me? Is she still back?
Dupe,
She's
can you
on the
hear
call
us?
right now. I think her network is still maybe trying to connect or something like that.
Dupe, are you with us? Can you hear us?
Because I was enjoying her presentation and she has done quality work in their research. So I just want to confirm if she's the only person that did the work, or how many people are in group one? How many people did you put in group one?
We have 13 people in group 1. And
How many
currently
people
I
are in
can
group
see
2?
um
How many people are in group 2?
in group 2 we have 12 people in group 2.
Meaning that we have 25 persons for this course. Is that what you're saying?
Yes, sir.
So how come only less than 10 were here last week? And today, how many people are here now?
So we gave them the opportunity to have 2 weeks. After 2 weeks, we will be doing an evaluation of those who are not committed to the program, and then if there's need, we'll be removing some people from the program that are not committed to the program.
Okay. So is Dupe set?
I think
If
she's
she's
still
not,
having network
okay,
issues, so
Dennis,
she's not.
we will not waste further time. I'm going to send you my slides so that you help me and do the display. I'll forward my slides to you now.
Okay, sir.
I'm so sorry for the break in transmission. I think there was a problem with MCN generally, but I don't know if you can hear me
Okay.
now. Please, if you can. Thank you so
We
much.
Okay,
can
So,
hear
Dupe, are you back? Welcome
yes,
back. Can you hear me?
yes, I can.
Okay. How many of you did this work
All right. So we
from your
were
group?
5 that I'm aware of. 5 people.
Okay. So who and who? Where are they? They are not on call today. Why?
I'm not sure why they are not on call, but I know. Let me check to be sure that some of them are not on the call. Participants. I don't know why they are not on the call at the moment. For myself and
Okay.
Deborah worked on the presentation. She worked on the presentation, then put us through that this is what she created the PowerPoint, sent articles for us to read through.
Okay. Deborah did the research.
Yes, she created the presentation, the PowerPoint.
Okay. Okay. And now explained to you people.
No. We had a video call, a voice call where we spoke about, okay, this is what this means, this is how it is. Then the following day, from our discussion, the following day, she created the PowerPoint, then sent it to us.
Okay. Okay. That's the 5 of you.
Yes.
Okay. So forward the name. Are the names of the contributors, is it contained in your slides?
I'm so sorry about that. It's not, but I would get there.
Okay.
I can.
And now after the class, send the names to Mr. Dennis.
All right.
It's okay. Continue.
All right. Thank you so much. So I'm looking for the slide now. I'm so sorry. I'm trying to get the slide. Yes. Thank you so much. So then we move to medical malpractice trends and preventive measures. So by way of definition, medical malpractice can be defined as the negligence or misconduct by a healthcare professional that results
So
in
we are not doing medical malpractice today. I just want us to focus on patients, medical healthcare fraud and abuse. So medical malpractice, patients' rights, we will discuss it next week. I want us to understand the far-reaching effects of the topic we are dealing with today.
All right. So that's all we have on healthcare fraud and healthcare abuse, sir, that we're able to get.
Okay. I'm trying to send my this thing to Dennis. Dennis, I can't see your number here. So just send me hi. Say hi to me on WhatsApp.
All right, sir. I will do that, sir.
Okay. 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 I'm forwarding it now. Sent. I've forwarded it. Have you seen it?
Yes, I have. I will be opening it right now, sir.
Okay, awesome. So, gentlemen and ladies, just exercise a little patience. We have 10 participants on the call today. In fact, less than 10, 7 actually, because myself, Dennis, and Emanuela are more like facilitators or from the administration. So, okay, I can see the slides. So can we make progress? Good. Okay. Go to the next slide. The next slide. Yeah, introduction, definition of healthcare fraud. Dupe, you said you're a medical student, right? Hello,
Yes,
Dupe.
yes. Hello, yes,
Which
I'm a
school?
Ekiti State
Were you here
University.
last week? Ogun
No,
State?
start here. Ekiti State University.
Okay, Ekiti State University. You were not here last week.
No, I was.
Okay. So healthcare fraud. Dupe in her presentation captured the definitions. What is healthcare fraud? When you talk fraud, we are looking at intention. What did the person set out to achieve? What was the person's objective? To extract more money from the patient. Then when we talk about healthcare abuse, yes, there might not be necessarily intention, but there is harm done to the patient by way of excessive cost. There is also harm done to the management, which we will look into. Dupe, you did not tell us the implications. What are the effects of healthcare fraud and healthcare abuse? How does it impact healthcare service delivery? Your group did not discuss that. Then, how do we prevent it? You also did not discuss that. So next slide. We have a long way to go. Types of healthcare fraud. She talked about billing fraud, upcoding. She has already explained it. In fact, I'm impressed with the little effort they're putting, the depth of their research. Upcoding basically is adding bills, adding money for services that were not rendered, adding more than was rendered. Then unbundling is when a package, the cost covers one package, or rather, different services are contained in one cost package. Like she rightly said, if you are going for surgery and they say the surgery is 50,000, inside that 50,000, the cost of anesthesis is there, the consumables that will be used in the theater, all of them are there. But if they want to extort more money, they will now unbundle to say the cost of anesthesis is this, syringe is this, scalpel is this, surgical blade is this. Then the antibiotics you will be given after the surgery is this to prevent infection. Do you understand? So when they now unbundle, the service came as a pack, one package. When they now unbundle it, they are bringing separate items that are already contained in that service package. So Next slide. Okay. What are the types of fraud too? False claims. False claims where services were not rendered. You now see for people who are maybe under NHIS or health insurance, or people whose companies usually write off their healthcare bills. You now see them go to hospital, generate claims, records that did not exist. Maybe they send somebody to go and do fitness tests. The person goes to hospital, doesn't do any fitness tests, then the hospital writes a fitness test report to say, yes, we have examined this man, his heart is this, is fit for the job. Now, that is healthcare fraud. The implication of that is assuming that man with that falsified document or claim goes to work and he's engaged, maybe in the military, and he collapses because he will be engaged based on the medical reports. There have been cases where people, particularly people who want to get married, they go to hospital to run genotype test. They say, lady, go and run your genotype test. She goes there. She is AS. She now tells the lab scientist to please give me another result of AA. I will pay, or she's SS, she's AS. She now says, give me another result of AA. I will pay XYZ amount. And the person gives her that result. That falls under this. Prescription fraud. We already know what prescription fraud is: forging or altering prescriptions, illegally obtaining or distributing controlled substances. There are some drugs that you can't buy them over the counter. They are strictly by prescription. Then where the person who maybe you want it, you now go to a doctor. The doctor prescribes for you. Even though it shouldn't be, you go over the counter and they give to you. Or you just go and meet the pharmacist. You are buying this drug without even prescription. Then kickbacks and bribery. Then representation, false information about qualification. Your hospital does not have a cardiologist or a consultant. Then you are dealing with issues that relate to the heart, maybe heart attack issues. You don't have a cardiologist. And when they bring this patients come for consultation, you say, we have this, we have this. You are making false representation. Even if you have a consultant who comes to your hospital, your hospital does not have that capacity, because it's possible the day the man will come, your consultant will not be around. Or maybe you have given your consultant a date. This patient is coming on so and so day, and your consultant agrees, I will be available. On that day, the consultant has emergency that makes him not to be available. So misrepresentation is fraud also. Let's go to the next slide. We've talked about fraud examples. What about abuse? What are the types of healthcare abuses? Excessive services. She aptly captured it in her example, where you are told to run tests that are not needed or necessary. Then substandard care, quality care that is not up to standard, and the healthcare professional knows. Then misuse of resources, inappropriate or inefficient use of resources, overusing medical equipment or even personnel, sometimes even stretching the healthcare personnel is an abuse, because he will not be fit or in the right state of mind to attend to give his or her optimum service delivery. Then unnecessary tests, we have talked about that, or procedure. Then improper billing still reflects here. We have talked about that. Next slide. Okay, what are the impacts? This is where you people did not say anything. What are the impacts? There are basically three impacts. Number one, A, is cost, financial cost. You have increased healthcare costs. How? Overpayments. Now, the upcoding or unbundling, which we already know, leads to overpayments. Now, resource misallocation is another consequence of financial cost. Under resource misallocation, you see that resources are diverted to cover costs of fraudulent claims. Now, there is a fraudulent claim. You are claiming for services that was not rendered, and the company now pays. That is resource misallocation. This money could have been used for something else, but because you are making a false claim, the patient is even forced, or the patient's company or whoever is writing off the medical bill is forced to pay for that service. Then higher insurance premium. We already discussed this also, that the financial losses from fraud and abuse often lead to higher insurance premium for all insured individuals. Now, insurance companies may raise alarm to say, okay, you people, you always visit hospitals, so there is need for us to increase your premium, or your services, the healthcare service cost you incur on us is actually slightly above your premium. So we have to increase it. Then increased administrative costs. You now see investigation of compliance. Now, the time that people will use to do other things, they are using it to investigate whether you people are compliant. They are using it to dictate. They are using it to even manage cases of fraud. That is time wastage. And that we know here, we say time is money. And when the administration of the hospital is engaged in loss of time, it is loss of cost, or of money rather. Then claims processing. There are even sometimes that people are billed fraudulent billing. Now, one of the rights of patients under the National Health Act is right to transparent billing, meaning that you are being informed as you are incurring your bill. You are being informed for each service you are rendered that is rendered to you. They tell you this is the cost. You add it to your existing bill, so you follow through on how that bill was generated. But here, the service is rendered, the bill is upcoded. Then, if the patient discovers the process of resolving that thing, that's what this place is talking about. That process of resolving it brings administrative cost to the system. Next slide. Still under A, public impact on impact on public health programs. Now, strain on resources. Public health programs like Medicare and Medicaid. Now they are the same thing. Medicare and Medicaid are the same thing. Medicare is the healthcare, the treatment you receive. Medicaid is the assistance you get from healthcare professionals. Now, both of them are already under financial strain. You now see facing additional burdens from fraud and abuse. This can lead to cuts in services or reduced benefits for legitimate beneficiaries. So when they restrain on the system, you will now see a situation whereby healthcare professionals are not allotting adequate time or adequate resources to the patients. Next slide. We've talked about 1. 2, now patient impact. First one was financial impacts, financial cost to the hospital and to the patient. Now, direct impact on the patients. 1, compromised patient safety, unnecessary or harmful treatments. When you are doing over treatments, when you are just treating because you just want to get more money, it can expose the patients to harm. 2, inaccurate medical record. Because this record you want to use to collect more money are falsified. So you just allot whatever number or figure or data, you just impute data there so that there'll be something. Now, if you now match it or the patient now undergoes that test, you see that you have already messed up the patient's medical record. Now, the ripple effect of this is if another doctor comes to treat that patient, the doctor will look on the existing medical record and they will not ask, was this test actually carried out? Was this test actually carried out? The doctor is just going to look, except some doctors who are careful, more careful. When they now see some inconsistency, they could order for a repeat test to now get the accurate medical record. Diminished quality of care. We've talked about resource drain, which makes the patients to keep giving money and money and money over what is not treated. Substandard care, the same with quality of care we saw in the first slide. Providers may cut corners or deliver substandard care to compensate for financial losses or because of pressures from abusive billing practices. Next slide. Erosion of trust. This is very, 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 very serious. Because once loss of confidence, you see, patients talk. Oh, somebody might visit hospital A, another person visit hospital B. One day they just start talking about their hospital experience. Once your hospital is flagged as either always billing people, either always giving substandard treatment, then patients will start avoiding your hospital. When patients learn that fraud or abuse is occurring within the healthcare system, their trust in the system or healthcare provider and institutions can be severely damaged. This distrust can deter them from seeking necessary care or following recommendations for recommended treatments. So loss of trust or confidence, erosion of trust is a serious disadvantage. Then unexpected costs, we have already discussed that. Insurance issue, increased financial burden, unexpected cost, delayed or denied care. We talk about insurance issues. Fraudulent claims can complicate insurance processes, leading to delays or denials of coverage for legitimate medical services. Now, all of this can worsen the health condition of the patients. Next slide. Number C, what is the impact the healthcare? We have talked about financial loss. We've talked about patient impact. Now we're talking about healthcare system impact. You now see that there is increased cost and financial strain on the healthcare system, higher expenses, then resource misallocation. We have discussed this. We've talked about administrative burden before, but here you now have complex claim processing. When a claim has been made and the patient discovers, the process of going through the system again, recomputing the patient's claim to correct it, is time loss, and that is money going. Then compliance and legal costs. In some cases, there might even be legal issues. The patient might decide to go to court. Then, even if the patient does not go to court, if there is a committee that is set up and they invite the patient to come and tell your story, maybe the accountant this time around or the cashier to come and tell your story, it is still an impact on the healthcare system. Next slide. Next slide. Impact on the healthcare system continues. Strengthening regulation. Detection and prevention of healthcare fraud. We've talked about healthcare fraud. We've talked about the impact. Now, how do we detect and prevent it? Because the goal should be solution. What solutions? Strengthening regulations. We have existing regulations. We have existing laws. We can strengthen them to give them more teeth to bite. So, 2, monitoring and auditing. the system, monitoring the healthcare professionals, monitoring the accountants, and auditing the system periodically. Data analysis, use data analytics and artificial intelligence to detect unusual patterns or anomalies in healthcare transactions and claims. Now, Nigeria, or generally our general hospitals, for private hospitals, some of them are doing amazing in this area, but for general hospitals or government hospitals, they are yet to get to this. Then training and education, continuous professional development, training and retraining, capacity building for the staff, teaching them on the impact of this and also how to prevent it. Then even the patients need to be trained, because a lot of patients do not know that these things happen. So when we do, that's the number 5 now, public awareness about healthcare fraud, so that patients can also report. The next slide. Detection and prevention of healthcare fraud continues. Whistleblower protection. You see, I think it was in 2016 or 2017, the central bank, the Minister of Finance, yes, brought out a whistleblower policy as a strategy to fight corruption. And they said, if you report anybody that you know has stolen money, 5% of whatever loot the person had stolen will be given to you. And people started reporting up and down. They started discovering, I don't know how many of you can recall when they started discovering money in mud houses, in GP tank, in what's it called, Sockaway tank. They started discovering money everywhere. It wasn't magic. It was just relatives of those persons that were reporting them, with the hope that they will get 5% of the loot. Unfortunately, your government could not live up to that promise. In fact, Minister of Finance reported that within 1 month, maybe 3 months, their website crashed because of pressure. People were reporting, there is this one here, there is this one here, there is this one here, and that crashed the website. Now, if you put a whistleblower protection policy and you honor the policy, what it means is that where a staff notices a fraudulent activity, that staff of the hospital will even be the one to do the reporting. So, and if staff begin to report themselves, all they will just do is to stop it, because if they report you today, apparently you can be sacked. Then interagency collaboration. There is need for the law enforcement agents to collaborate, even the professional bodies of the healthcare practitioners. There is need to foster interagency collaboration. There, nothing stops the collaboration between Medical and Dental Council of Nigeria and Nursing and Midwifery Council. Nothing stops the EFCC from collaborating with ICPC and the police in terms of investigation. So interagency collaboration, then enhancing transparency. So there is need to implement transparent measures that from procurement to billing to resource allocation. So this will reduce opportunities for fraudulent activities. Next slide. Implementing effective compliance program. That is another one for best practices. Go back to the previous slide. We've talked about detection. Now, follow the trend. We have defined, we have defined, we have looked at the types, we have looked at their impact, we have looked at detection and prevention. So go to the next slide now. What are the best practices for implementing effective compliance program? One is leadership commitment. You must have heard the saying that everything rises and falls on leadership. Leadership is everything. And that's also part of our problem in Nigeria, that there is no sincerity of purpose from our leaders. So the leaders pay lip service to the laws, to the regulations, to the policies. They just come and speak good English, but there is no commitment. So if the top management demonstrates a strong commitment to compliance by actively supporting and promoting anti-fraud policies, you will see that it will stop. So one best practice is leadership commitments. Now, this is under A, implementing effective compliance program. Everything we are talking about under this is under compliance. B, written policies and procedure. Yes, that is ordinarily supposed to be, we call it SOP, standard operation procedures. Some call it standard operation manuals, meaning that this is the procedure to do things step by step. If a patient comes to this hospital, the patient reports to this place, the patient is given a card, this happens, this happens, this happens, this happens, step by step, written. There is no assumption that Shebi, he's a doctor, he should know. Oh, he's a nurse, he should know. Oh, she's an accountant, she should know. No, there is no such assumption. So when you have written policies and procedure, it also spells out the punishments for in cases of default. So if you are punishing a defaulting staff in line with the prescribed punishment in the procedure or policy of the organization, the defaulting client or the defaulting staff rather will not feel that he or she is being witch hunted, because that's always our excuse here. Either I'm not the only person doing it, why are they singling me out? I am being witch hunted, all manner of things. So if it is written down, the person will know that he or she is not being witch hunted. Training and education, we cannot overemphasize this. Continuous professional development is key, very, very important to this. So there is always need for training and retraining of staff and all the employees. This one has to do more with money. But there is this practice by healthcare, by hospitals. They train their doctors, they train their nurses, they train their clinical staff. Then they forget that the accountants, the people in record, the administrative staff also need training and retraining. Risk assessments. There is need to conduct a periodic risk assessment to identify potential areas of vulnerability to fraud and abuse. So these assessments could be in any form, but most importantly, after assessing, how do you communicate this to your staff? Let them know, because if you do assessments and it ends with you at the management level, you have really done nothing, because the attitudinal change you want to achieve will not materialize. Monitoring and auditing, we've talked about it, but this one is implement routine internal and external audits to monitor compliance with policies and procedures. Regular audits help dictate and address potential issues before they escalate. Reporting mechanisms, it establish a confidential reporting channel. This is very key. We talked about whistleblowing. If you go to some hospitals, you will see either a Servicom desk or you see what's it called, complaint box. Now, I don't even know whether people really put in complaints there, one. Two, I also do not know whether if people complain, the hospitals respond to them. Maybe this is this is a research I will have to carry out independently. Next slide. We've talked about one, implementing compliance policy. Two now is promoting ethical practices. One, to have clear code of ethics. Now, every profession, well, every discipline within the medical and healthcare service delivery spectrum have their own code of ethics. Doctors have, nurses have, pharmacists have, physiotherapists, all of them, they all have. Now, nothing stops the hospital from having their own code of ethics, but that of the hospital must not override the professional, or rather counter the professional code of ethics. So if you are a professional, maybe you are a doctor, you have the code of medical ethics, and you now are engaged in a hospital, and the the code of ethics of the hospital is in conflict with the provisions of your professional code of ethics, you have two options. Option one is to resign. Option two is to point out that conflict to the management of the hospital and inform them that you are primarily bound first by your code of professional ethics. Then regular training, we cannot overemphasize this. Three, effective reporting mechanism, just spoke about it. Then leadership commitments comes here again. Everything rises and falls on leadership. If the leader does not demonstrate commitment beyond lip service, the follower will also reflect that leadership style. Then transparency in operation, very key. If a hospital tries to, how do I put it? If a hospital tries to cover up and they are not transparent in their operation with the patients and with even their own staff, they'll be teaching the staff inadvertently that if you do this, we can always cover you. Okay, on Thursday, was it Thursday? Yes. On Thursday, I had the privilege of speaking as one of the guest speakers at an event, All African Medical Awareness Expo, which held at, for those of you in Abuja, which held at Nikon Luxury Hotel on Thursday. I was one of their guest speakers. Now, this is a medical awareness exhibition. We had hospitals from Turkey who came to exhibit, hospitals from Egypt who came to exhibit, and different parts who came for the exhibition. Now, something happened. They lodged in the hotel where the event was holding, and one of the international guests, the hospital cleaner, the room service cleaner, the cleaner went and stole their money, their dollars. And one of them just discovered and said, he told his other brother, in fact, he stole the dollar of the Egyptians. He said, see, my money is missing now. He was just telling his brother, this is why I noticed that my money is missing. And the brother said, I also had the same experience. Two of them now told the third person. A third person said he also had the same experience. Oh, God. It was, meanwhile, before the program started, I had engaged with these people, the person from Morocco. I had engaged with her, talked to her, and most of them, it was their first time in Nigeria. So before the program started, I had engaged with them. How I hope you're enjoying your stay in Nigeria. I hope, yeah. Tell me what have you heard about Nigeria before coming and all that. The Moroccan lady shared her experience. The Egyptian people shared their experience. Then later in the course of the program, this thing now came up. But why I'm telling this story is that the hotel management did not cover that person. As soon as the report came, the person noticed that a report has gone out. He quickly ran to return the money. But when he was found out, when they discovered the person, promptly, there and then, the hospital gave him a sack letter. Because these Egyptian guys were threatening to escalate the matter. I say hospital, the hotel, there and then fired that guy that stole that money. And we took myself, one doctor, and the host of the program. We took more than 1 hour, 30 minutes to pacify these guys. Now, why am I telling this story? There was transparency. The hotel did not try to protect their image. The hotel did not try to deny. The hotel did not try to cover up. Even though the damage was not just done to the hotel, but to Nigeria as a whole. Because what perception will these guys be going back with? It will be that these things we hear outside is true. So transparency in operation. Strict compliance monitoring, we've talked about it. Ethical culture, very important. Last week, we talked about ethics, and we also went through the impacts of ethics, the importance, and all that. Engagement with stakeholders. This is key. Where, sometimes you don't even know the owners of hospital. You just hear the name. Then there is somebody who is engaged as the manager or the MD or the CMD, Chief Medical Director, or the medical director for private hospitals and all that. But sometimes the real owners of that hospital are not even medical doctors. They just have money and invested. So if issues arise, there is always need to engage with the stakeholders and tell them the accurate position of things. We are not going there to save face. In fact, it is face saving to tell the truth, and it ends there. Because when you lie and it further discovered that, and it is later discovered that you lied, that worsens, of course, the situation. Next slide. Next slide, Dennis. Regular reviews. Go back, the next slide, yeah. This is the third one. Regular reviews and updates. Now, we talked about policy and procedure review. We talked about having policy and procedure. Now, we are saying this policy and we are saying regular reviews and updates. This policy and procedure, what do we do to it? We update it. If there are new ways, maybe after 3 years, after 4 years, you review your policy documents, your SOP. You review it. If there are new things, you add them. If there are obsolete ones, you remove them. If there is nothing to remove or add, you retain it as it is, but you update the year that this one is the current one. Then training and retraining. You also review and update your trainings. It will be wrong to be training and repeating the same thing. The essence of training is improvement. The essence of training is to get the latest skill. The essence of training is to get the most recent way of doing this, the improved way of doing it. So you also review your training curriculum. Audit monitoring. You compare notes. and review. If you have done audits for maybe every 6 months, maybe every 1 year, if you have done audits for 2-3 years, then at a point you sit down, these 3-4 audits reports, can you bring them together? Let us review. Then you analyze the audit reports. You analyze your monitoring reports. And you find out, okay, is this method serving us? Is there need to review? Is there even need to change? What if the perpetrators of this thing have gone to connive with the auditors? There is no place that corruption does not stretch its hand. So you can even, your review can be a change of auditing firm. Risk assessments, we've talked about it. Regular risk assessments help identify new vulnerabilities and adjust preventive measures accordingly. This proactive approach enables healthcare organizations to address potential issues before they escalate. Now, the example I gave you about the hotel last Thursday, the management addressed that issue before it escalated. If I didn't mention it now, most of you will not know, or in fact, all of you will not know if I didn't say it here. But assuming the hotel did not take that measure, they have assessed the risk. If this thing gets out of this place, we are done with. Maybe now it will be flying all over social media. And once it enters social media, you have lost control. So they assess the risk. Okay, what we can do to manage this, to do this damage control. First of all, Mr. Thief, you are hereby fired in writing. Feedback mechanism. Unfortunately, we run a system where people do not like feedback. We think that feedback is hatred, or we are a society that feeds some praise. We just like being praised. Oh, you have done, even when you know you are messing up. So it is in your best interest, it's in the best interest of the organization to have a feedback mechanism. If you write to tell the head that, sir, I think this should be done, this should be done, this should be done. I think we didn't get this right, you didn't get this right. Because the head is the person who brought that idea, and you are subordinate. He will not see it that you are trying to make the company or organization better. Rather, he will see it that you want to undermine his authority. You want to undermine his office. You want to make him look incompetent. Now that it is his turn to shine and eat money, you are bringing up rubbish excuses that will make him not to. You want to dent his record. But it is through feedback that we see our mistakes, that we see where we need to adjust, that we see where we need to amend. So implementing and updating feedback system for reporting suspected fraud or abuse encourages transparency and helps organizations respond swiftly to issues. So this is all we have for this topic. Are there questions? I'll be willing to entertain the questions. This is the conclusion. Healthcare fraud and abuse are unprofessional conduct in healthcare service delivery. Their negative impact affects the patients and the healthcare system in a manner that,
Please, if there are any questions, if you have any questions now, you can put them on the chat box, please.
the person can even ask the question. The person
Okay,
can
if you
raise
have any
his hand,
question,
you're muted, and you ask your question.
okay, you can just indicate, then I'll call upon you so you can ask your
Yes.
question.
Yes.
Okay, so we have one question from Esther Ibin. She said, if a patient should be defrauded while receiving healthcare, what can he or she do?
If a patient should be defrauded while receiving healthcare, what can he or she do? Report to the management. In fact, take it up immediately. As soon as you discover that you have been defrauded, firstly, politely approach maybe the accountant. If you discover that it is for payment of money. Now, if it is recommended tests that are not necessary, escalate it immediately by talking to the management. If it is one-man hospital, tell them there are places you have one-man hospital. Only one person is the doctor, he's the nurse, he's the everything. And okay, there's a video. Yesterday, maybe 2 days ago, somebody died in Lagos. A woman, she went to do BBL, she went to do Brazilian butt enlargement. And the operator or the owner of the so-called hospital, when the woman got there, the operator was not on seat. She now instructed a cleaner, did you hear me? Cleaner, to administer injection on the woman. I will drop the video on the platform. And the cleaner administered the injection, and the woman started convulsing. Before they could rush that hospital, she died. Now, how did people know? Because the driver of the woman, the deceased, her driver conveyed her to that place and was waiting before this whole thing played out. Nobody knew the lady was a cleaner. It was when she was arrested that she mentioned she's a cleaner. Now, the person who gave the instruction has run away. So, the issue with healthcare fraud and abuse is that sometimes the impact could be human life. So, if you notice healthcare abuse, escalate it, report it. Report to if it is a nurse or a doctor that did it, report to the management of the hospital. But before you start reporting, make sure you have your evidence so that you do not start what you cannot finish. Yes. So before you start escalating, establish it. Establish that fact that this thing happened. Then you report. Any other question? Do we have any other question? I can't hear you,
Yes, I
Emmanuel.
have a question.
Okay, please ask.
That is, what are the remedies for okay, first I want to thank you for this session. It was so educating. I want to ask, what are the remedies for an abused person, like is it the negligence or trespass to the person?
What are the remedies for
a patient that is abused that wants to go to court for
okay
that
for
wants
a
to go
patient that is abused? Okay, that borders on patient's right. We will discuss it tomorrow. I say tomorrow in our next class. But the available remedies, basically, there are three redress mechanisms available to a patient whose rights has been abused. One is administrative remedy. Administrative remedy deals with engaging with the hospital management, the admin of the hospital. This is what has happened to me. This is what has happened to my son. This is what has happened to my child. This is engaging with the hospital, starting with the person who committed the abuse. So when you engage with them, they might make offers. They might apologize if it is not too severe. If you are pacified, it ends there. But if you are not, there is nothing that says you must take whatever they said. Stage 2 is professional redress. You report the doctor to their professional body. For nurses, you complain to Nursing and Midwifery Council. For doctors, you complain to Medical and Dental Council of Nigeria. The appropriate sanction will be meted to that defaulting healthcare professional by their professional body. That's professional discipline. Then the third one is legal remedy. So we have administrative, we have professional, we have legal. Legal remedy is twofold. You can file a civil suit where it does not involve loss of organ or does not have a criminal element. For example, if there is a case of organ harvesting, somebody goes for surgery and they remove one of his kidney without the person's knowledge, so that is theft, that is organ harvesting, that is medical malpractice. So it is a criminal matter. You report to the police investigates, after which a criminal action is instituted against that doctor or nurse or whoever is liable, responsible. Then, if it involves deaths, murder is flagged, manslaughter is flagged, you still report to the police. A criminal investigation is carried out, including autopsy to determine the cause of death. After that, a criminal action is instituted. But where it has no criminal elements, you file for civil action claiming damages. So, provided you have your evidence, that is it. So those are the available remedies. We will still discuss it in our next class under patients' rights.
Okay, so we have some other questions. It says,
Yes.
in most government hospitals, a high percentage of the public receives substandard care. How can this be combated?
Okay, by reporting. Now, who asked this question?
It was Omokere Ogeneron. Sorry if I didn't pronounce it.
Omokere.
Yes, sir.
Good.
Yes, sir.
What are you studying?
Family law students.
Awesome. Now, your question is a very good question. Now, how do you determine that the care is substandard? Do you get it? Why? Just wait, I will
Yes.
answer the question. Because here, our people are good at covering. So in our next class, we are also going to do evidence gathering. Before you open your mouth to make any allegation, you have to substantiate it. So where there is substandard care, what is the standard care? Because there must be comparison. You must have this background knowledge. That's why if this is a court, the cross-examination question they will ask you is what I asked you now. Are you a medical doctor? You say no, my lord. Are you a nurse? You say no, my lord. What do you do for a living? You say, my lord, I'm a law student. Now, that automatically impeaches anything you want to talk about standard care or substandard care, because they will tell you in courts that you are not professionally trained to know what is standard or substandard care. But that's an aside. Straight to your question. Firstly, gather your evidence. 1. 2, report to the appropriate regulatory body. 3, escalate it. By escalating it, bringing it to the media. Because I can speak for Medical and Dental Council, not as their spokesperson, but sharing my experience I've had with them. They are thorough. They do not cover cases. They do not protect anybody, any erring doctor that goes to Medical and Dental Council. Even if you come out clean, just know that your case, you are discharged on merit, because they are fellow doctors. They know what you know. Do you get it? So I can tell you that free of charge. I have done cases before them. I've done petitions. I've filed petitions before them. So I can tell you that clearly. Any other question?
Yes, sir. She says
Oh,
the
yeah.
issue of unnecessary
The
tests or
second question.
procedures is paramount. How do patients without knowledge of healthcare
The
combat
issue
this?
of, please repeat that
The issue of
question.
unnecessary tests,
Um,
the issue of unnecessary tests or procedures
Okay.
is
Yes.
paramount. How do
Yes.
patients without the knowledge of healthcare combat this?
Okay. One of the solutions we prescribed here is awareness. Do you get? Unfortunately,
yes, sir.
the awareness level is low. Very unfortunate. The awareness level is low. So that's why you have some NGOs who go about sensitizing people. Two, we are not a reading people. We believe more in superstitions and how do I put it now? Conjectures. So if somebody just says something, we don't have a research, we don't verify. So we don't self-educate. That's the point I am making. So there is a big challenge. One of the solutions is consistent awareness, consistent sensitization program, one of which is what we are doing in this class. All of you have enrolled because you want to have idea. Tomorrow, when a healthcare fraud is happening around you, you should be able to dictate it to know. Then again, I ask, if let's say issue of multiple tests, you have Google is your friend. There's nothing wrong in carrying your phone. What are the relevant tests to conduct to establish malaria? What are the relevant medical tests to conduct to establish a case of breast cancer, brain cancer, heart attack? Those basic knowledge, that does not make you a medical doctor, but it's your body that is being treated. So there's no harm in finding out, just having a background knowledge. So next question. The solution to that is awareness, awareness, awareness.
Okay, thank you, sir. The next question is, in our society, when someone takes money
Thank you,
to
sir.
bypass the process, most people on the queue will shut you down as if it is not an issue. What can we do?
Okay, in our society, when people take money to bypass the process, most people on the queue will shut you down as if
As if it is
it
not
is
an
a non,
issue.
as if it's a
Yes.
non-issue. Okay, what
What
can you
can we
do?
do?
What you can do is to educate the people on the impact of what they are doing. You educate them on their collective ignorance. I did not say insult them. No, you educate them that this is why Nigeria has been where we are. That if this continues, these are the impact, these are the impact, these are the impact. Then beyond educating, if you are educating them and they are not cooperative, you can put your feet down and say, no, I am here, I was here before you, I get attended to before you. So you insist on your rights. Now, in insisting, approach is everything. There's even a way to correct somebody. You do not insult people in the name of correction. You do not engage in name calling in the name of correction. You do not engage in abusive languages in the name of correction. Oftentimes, that's what we do. So we even lack the basic communication skills that we address, that we get the attention. We start off with the offensive. We show how we are richer than the other person, how we can feed his entire family, how he did not go to school, how you are a lawyer and he's a nobody, how your father is this and that. That has not addressed the issue. So stay on the issue. Sir, I've been standing here for 2 hours. I have other things I need to do. So it is my turn to be attended to. Or after attending to these 3, 4 people, it becomes my turn before you. Then the people who allowed him to shunt the line, You educate them that tomorrow you will blame the president, next tomorrow you will blame the governor, that Nigeria is bad, because Nigeria being bad is actually human beings' attitude, basically not doing the right thing at the right time. That's all. What do we call corruption? Corruption is not doing the right thing at the right time, not doing the right thing at the right time, or doing the wrong thing outright. So if you are not doing the right thing, the opposite of right is wrong now. So it's not always when it involves money that we know it is corruption. So if we begin by little attitudinal change, just attitudinal change. Somebody was telling me a story of his visit to Japan. Said he went to Japan and there was this escalator you see in malls and shopping complexes. One was coming down, the other was going up. But the one that was coming down was switched off, so it was not rolling. And nobody was coming down. That one was static. Crowd want to go up. This guy told me that people queued on that one that was going up. Nobody wanted to quickly use this one that is ordinarily coming down but is static. So that makes it a staircase for you. You can just run and climb up. The guy was wondering. He said people queued there. Just attitude. Come and try it in Nigeria. Even the one that is going up, people will want to jump on it and see if they can get up faster. So that is the problem. And again, let me warn you, be ready to be hated, be ready to be disliked. The problem again we have is that people are afraid to stand alone. So everybody wants to be liked. Everybody wants to be the good person. Now, when you hear this person is a nice guy, this girl is a nice girl. For those of you who are Christians, one of the fruits of the Holy Spirit is not nice. Jesus was not a nice person. We misunderstand what nice is. There's a difference between good and nice. Nice person is that you don't want wahala, you just want piece of the graveyard, even if it is costing your life, and you are being deceived by being told you are nice. Anytime they are telling you are nice, they are actually cheating you or depriving you of your right. Nice simply means you have seen this wrong, please don't complain about it. Are you aware that a thief who steals money and comes to share it to people will be seen as a nice person? Even though people know that he's a thief. And when people come, we all heard the story of Anene, how he will steal money and go to the marketplace and share to the less privileged. But everybody knows he's a thief. So the source of the money is not legitimate. Now, Lord Denning will tell us that you can't put something on nothing and expect it to stand. If the foundation is faulty, every other thing that is standing on it is faulty. So if you must effect change, get ready to be disliked. Get ready to stand alone. Get ready to receive backlash. That is the problem of us. It's not as if everybody doesn't know that, including the person doing it. It is wrong. But when you start, it's your family members that will draw you back and say, are you the only person that saw that thing? Are you the only person that is there? Didn't you see other people? Why did you not keep quiet? Must you be the one to say it? That's the backlash. So Okonjo-Iweala wrote a book. She said, fighting corruption is dangerous because as you're fighting corruption, corruption fights back. So that's if you are in a place, be vocal, but in your being vocal, try as much as possible to be respectful. Address the issue. Leave name calling. Leave insult. Focus on the issue. You jumped the line. You jumped the queue. Not that you are an idiot. You are senseless. That's an insult. Maintain the issue so that if somebody comes, what is the problem here? You can say, sir, I've been here for 3 hours. This is what happened. This is what happened on the issue. The person you are correcting will not have opportunity to say, he called me stupid. He said I am an idiot. That is diversionary. So you don't even give him the room. Have you people observed Peter Obi? Did anybody observe Peter Obi and how he responds to any insult or any abuse? He will still call you his respected elder brother, and he will maintain the issue. So you cannot come out tomorrow and say, Peter Obi insulted me. He has lost the election. He's not a president today. He wasn't the only person that contested for that presidential election. But he appears to be the only opposition today. Every other person has gone back to his business. Until then, till now, you cannot bring out one insult from him. But he has been correcting the government. Hey, government, this one you did is not wrong, it's not good. This one you did here is not good. Now, also be ready to be ignored. They say that the minority will have their say. The majority will have their day. So you say your own, you can also be ignored. Thank you. Any other question?
No, sir, that is all for the questions we have today.
Okay. If that is all for the question, it has been an exciting and engaging session we had today. Next week, the people preparing on patients' rights and malpractice and all that on the second leg of the topic, go and do a thorough job. I commended the group that presented today. I didn't, in all honesty, I didn't expect to hear some of the things I heard from them. So go and do a thorough job. Then we will meet next week, Sunday. I know that one extra week has been added to your schedule, but we'll find a way of resolving it. If we see any topic that is not too broad like that, we can collapse the two. But these two topics, today's topic, there's no how we could have taken all of them together. We have medical negligence, malpractice, we have patient's rights. In fact, patient's rights, I take it, patient's rights alone is a single topic. It's a standalone topic. But let's see how we navigate the rest of the topics on Sunday. Thank you very much.
Thank you, sir. Please, I would appreciate if everybody on the call turns on their camera for the picture right now. It will not take time. And I would also like to thank our mentor for today for taking us on this journey that was very enlightening. Personally, I've not had any experience in anything relating to the health sector, but just from his lesson today, it sounds so interesting and like something I want to look into. And I also like to thank our presenter today, JIIPCC, whose presentation was not only enlightening but also very interesting. And thank you very much for that. And I'll see you next week for the next session. Please, JIIPCC and Omokere, can you turn on your cameras for the picture? Okay, thank you very much. Have a nice day, everybody. Have a nice day.